Hello everyone. Welcome to the final part of our series Beyond the Stats. I've got mixed feelings because it is the end, but we are finishing on a high note, so I'm very excited. And this final part is called Ain't I a Woman? And in this series, we will be speaking to some amazing women who I truly admire around the issue of menopause. Now, menopause marks the end of a female's reproductive ability. And menopause is defined in retrospect. So once you've gone a year without periods, you are in the menopause. Once you go a year and a day without periods, you are postmenopausal. And on average, this will take place between the ages of 48 to 51. Now, interestingly, the menopause is part of the normal human life cycle, but menopausal women are often invisible in health and public health discourse, which is very strange. Issues such as hot flushes, mood changes, vaginal dryness, incontinence, they can have quite significant impact on your quality of life, but they are not spoken of. And what we also know is that the menopause is more than just menopausal symptoms. So, in the next couple series, we will be speaking to a huge variety of women about their perceptions of femininity and engagement with healthcare beyond the menopause. And I am really excited to be kicking this off, first of all, with a shiro of mine, Dr. Nigat Arif. Now, Dr. Nigat Arif is a British Pakistani Muslim woman and a mother navigating and uniting the different cultures in a positive way. She is a family GP with a specialist interest in women's health and family planning. You might recognize her because she is also a resident TV doctor on BBC Breakfast, This Morning ITV, and BBC Look East. And if you ever tune in on a Sunday to BBC Three's Counties Radio, she's also the talk show host, which is awesome. She is a passionate promoter of menopause care, wellness, self-care, and placing the patient at the very center of their care plan. She is also a member of Team Halo. This is an organization that's been working in partnership with the United Nations and the Vaccine Positivity Project to really help curb misinformation around the COVID-19 vaccination program. On top of that, she has a prolific TikTok account at Dr. Nigat Arif. That's DrNighatarif. You should definitely check it out. And an all-round amazing human being that I was humbled to be able to speak to today. Enjoy. Wow, so tell us a bit about you.
Oh, thank you so much, Issy, for having me. It's an absolute honour to speak with a fellow colleague and a researcher as well. I'm Dr. Nigat Arif. I'm an NHS GP with a specialism in women's health and family planning. I also have started in the pandemic doing a lot of work with vaccine advocacy with the UN initiative Team Halo, which is producing material to tackle misinformation around COVID-19 for hopefully to end the global pandemic. As well as that, I also do broadcasting, medical broadcasting with BBC Breakfast on BBC One, ITV This Morning, BBC Look East, and in the last 6 months, believe it or not, I have a radio show with BBC Three Counties Radio on a Sunday morning. Again, it's a topical show. We bring in faith, health, and local stories because that's what local radio tries to cater to. And amongst all of that, actually, I would say my proudest job is that I'm a mum to 3 boys. I've got a 3-year-old, a 6-year-old, and a 10-year-old. Wow. And they keep me very busy. But I'm really proud of being a mum. And I think that seeing the world through your children's eyes is actually the best way, because you see a lot of optimism that way. I also, amongst all of my other hats, I'm an advocate for a lot of different things. So I'm the ambassador for Noon, which is an online global platform trying to bring medical information and health information and well-being for women around the midlife, as well as an ambassador for the Roald Dahl Children's Charity, so children with chronic diseases. An ambassador for the Good Grief Trust. So we've been hit by grief a lot in the pandemic. and that mental health impact has been huge. As well as I have my own podcast, but that's in Punjabi with a non-for-profit organization called Seek Forgiveness. And with Seek Forgiveness, what we do is we produce in Urdu and Punjabi a podcast for the South Asian community tackling taboo subjects like grief, postnatal depression, how to take antidepressants, what OCD means, what panic disorders mean. So hopefully just breaking a lot of the taboos that we see when it comes to women's health and mental health.
Wow. How do you actually pack all that into a day? That is inspiring and amazing. And that's exactly why I reached out to you. And I'm so grateful to be chatting to you. Thank you so much for sharing that. So I guess we'll jump straight into the topic. You know, this series is called Ain't I a Woman? Talking about hidden figures and women around the menopause and midlife. So in your opinion, why do you think women disappear after the menopause?
You know what, Issy, I'm going to start with a personal story, if that's okay, because I'm a Pakistani woman. I didn't actually grow up in the UK. I came to the UK when I was 9 years old, and I speak Punjabi fluently. So I then trained as a doctor, and being entrenched in my faith, we go to the mosque a lot. My father is an imam, so he's a priest and serves the Sunni community in our local area. And growing up, women would always talk about their women's health problems, but it would be always shrouded. So in our culture, we have a word called parda. Parda means below the veil. Right. When you're talking about periods, when you're talking about women's biology, like breasts or vulvas or vagina, everything has to be below the parda, which means below the veil, because these are shameful things. You don't talk about periods. You don't talk about flushes. And so the idea is that a woman is prized in her fertility years because she's making the heir and the spare in our culture. But then when it comes to her menopause or midlife years, then, well, she's gone past her use or surplus, because unfortunately we do live in a misogynistic society, and that has been repeated over and over in many sections of society, not just the community that I come from. And so in our culture, it took me a long time to realize that we don't have a word for menopause in Urdu or Punjabi. The word that we have is called banji. Banji means barren. And when you realize that actually women are just seen as barren vessels after the menopausal age, then what is the use? But women then have tried to reclaim that, but amongst their own circles. So menopause is actually a fun time. It's a brilliant time. Your periods are stopped. As Muslims, you can pray 5 times a day. You can keep your Ramadan. You can go fasting. Hindu women can go to the temple. And so when we have attached periods with shame to the point where you come into your midlife years and there is no shame, it's actually quite a liberating time. So it's like the second age for women. However, as a doctor, what I realized is that women were sort of misunderstood around this phase of their life. So I speak to a lot of Pakistani women, so they'll come and tell me, not flushes actually, well, that wasn't the thing that I was listening to a lot of the time. They would gloss over the psychological symptoms because psychological symptoms are a taboo. So you don't want to be seen as a mad woman in your midlife years. And it's easier to talk about the physical symptoms. So I saw a woman once and she'd say to me, Sara kuch dukhda hai sir to leke pairan tak. That means everything hurts, Dr. Arif, from head to toe. My joints ache, my eyes are itchy, my mouth has a metallic taste in it. I've got this itchy rash everywhere, and I can't sleep very well, and sometimes get really sweaty at night, and I'm changing my clothes or I'm going into the shower to have a shower. This was a dear friend of ours, and I sort of couldn't piece all these hodgepodge information that she was giving me. She went to the doctor, who is Western trained. So he asked her, do you have flushes? And she went, no, I don't have flushes. And he did a blood test. And one of the markers that we use is called ESR. That was slightly raised, not hugely, but he put her on steroid tablets thinking that she has fibromyalgia because she's 48, everything hurts, her periods are a little bit erratic, but thought it might be fibromyalgia because the diagnosis of perimenopause hadn't even been thought about. So she got put on steroids. Unfortunately, as we know, with steroids can cause a risk of osteoporosis. She went outside into the garden, put her clothes up, had a slip in the garden, had a fractured neck of femur, was wheelchair bound, and then passed away when she was about 52 from recurrent sepsis and infections that she was suffering from. Now, the reason I share that personal stories because that was a dear friend. That's a woman that helped me grow up in the UK when I came at the age of 9. And unfortunately, this isn't a one-off story. Women will say time and time again that when they come to the midlife years, they do feel that they disappear, that they are seen as worth their surplus, they're not needed anymore. And with that, their biology is normalized. So their biological symptoms or the physical symptoms that they're getting of the menopause, well, it's normal. Why should we worry if a woman is getting hot flushes? All women get hot flushes, right? But hot flushes are in context. So I asked a woman, because I talked to a lot of women from Dubai, and I said to her, do you get flushes? And her context of flushes was that stand in the Dubai heat and you'll know what a flush is. And then if I speak to women from my community and I say to them, you know, I think the symptoms that you're describing to me are menopause, and menopause is a hormone deficiency transition that women go through. It's a natural transition, but we have to think of it as a hormone deficiency. So you lose estrogen and progesterone, and to a degree you lose testosterone as well. When you say that to somebody, that it's a hormone deficiency, their ideology changes. But this whole conversation around the midlife, around menopause, has been packaged with a Western conversation. So I said to my mother when she was going through it, and remember, I'm a GP that does women's health, and she's Pakistani, we're Punjabi, we're from back in Lahore, that's where we live, and she was having a florid flush right in front of me. And I said to my mum, I think you're having a flush. And she said, oh no, there are worse heat like flushes I've had in Pakistan. So again, her context was different. But I said to her, Mum, I think you're going through the menopause. And she said to me, that is something that white women go through. And that's when I realized that when you package women's health with a conversation which is westernized, a westernized conversation, then women don't feel it relates to them. And that's why women feel that they don't disappear as much, but actually it's not relevant for them because we've normalized a woman's pain. We've normalized a woman's flushes. We've normalized irritable, irregular periods. We've normalized the fact that actually if she's not sleeping at night and her mood is affected the next day, it's just a women's things. All women go through this. We've normalized the fact that actually women end up getting real breast tenderness at this time. They get memory fog, they become forgetful. And the worst thing is, you see, is that when we normalize something, we don't have a medical plan for these women because we don't even think of it as a diagnosis. So I have women who go and see the doctor and they'll say, I've got all these symptoms, and they'll be offered antidepressants, when actually it's a hormone deficiency transition in life. The first thing is, and the nice guidance since 2015 is, we should be offering these women hormone replacement therapy. But we don't. We pack them off with antidepressants. And to varying degrees, women don't respond to antidepressants, or they feel that they're not listened to. Why? Because we've normalized it. And that's why I end up seeing the statistics, which are shocking. 1 in 4 women will feel suicidal at the time of perimenopause. 1 in 4 women consider leaving their workplace. So that's at all hierarchical levels. You could be a consultant at your hospital to the cleaner at the hospital. And if you're going through that transition and you're not supported, you'll want to leave your work. And then 950,000 women leave the workplace at the age of, around the age of perimenopause. So they're still having periods, but they're having menopausal symptoms. And for me, as a women's health advocate, that just is gender inequality at the extreme. And we're letting it happen because we've normalized women's suffering.
Absolutely. Wow, that's very powerful, sharing your personal story and your personal journey in this. And I love how you highlighted that it's not necessarily that women disappear, it's that, when we essentially as medical professionals, as clinicians, normalize this, their symptoms or their experiences, then we don't bother focusing on their priorities and solutions to it. And so people believe it doesn't apply to them. And I love how, because a question I was going to ask later on was about, any sort of myths you've had to debunk. And what you shared, like really powerful, 2 things. One, the lack of the word menopause in your language. And that actually has inspired me. I don't know what the word menopause in my language. My local language is Igbo. I have to ask my mom. I actually don't know. I'm going to ask my mom about that. Yeah.
So how would you, as a woman who speaks Igbo, be then able to speak to a Western trained NHS GP and you're going through the transition, the menopausal transition, because you don't even have the word in your own language. And actually, I've got only recently, and I'm so ashamed to say this, but the deaf community don't have a word either. They have the word men and pause, and that's it. But that's not actually the word. So I have now in the UK, because of the pandemic, we started doing telephone consultations and video consultations. And then we have a hearing loop, so a British Sign Language hearing loop system. And it was only when I was conversing recently with a woman from the deaf community that I realized, oh my goodness, what she was trying to tell me, all these hodgepodge of symptoms, is actually menopause. But there was no translation in the British Sign Language. Can you believe that? 2021.
It's ridiculous. And, you know, in the UK, we are such a diverse population, and we're becoming even more and more diverse. So, you know, doctors like me, I still consider myself a baby doctor. You know, we are being trained in a system that really is not necessarily matching the needs of our patients and their families. So I'm wondering, like, you know, from your perspective as somebody with, you know, this professional experience, lived experience, and the experience within the community, and you work at so many impressive levels. You are first and foremost a human being, and you are part of community, and you have the lived experience, personal and also family, and you're a clinician, an advocate, a media personnel. What would your advice be to clinicians in this space who are being trained in a Western system?
So it's more the fact that I think whatever system, if it's Western, Eastern, wherever we are around the world, we need to normalize these conversations, because talking about periods, talking about menopause, talking about endometriosis, polycystic ovarian syndrome, because we need to be bringing these out the open. You know, a woman's pain cannot be normalized. It takes 7 years on average for a woman to be diagnosed with endometriosis. And we know from statistical studies that the diagnosis takes even longer for women of color because their pain isn't taken seriously. And you know that far more than I do. We know already that there are inequalities amongst the ethnic minority women when it comes to birth and pregnancy. You know, the maternity reports have shown that Black women are 5 times more likely to have serious complications and death when it comes to birth. And that is something that we shouldn't be putting up with as a society, and definitely not as healthcare professionals. So I say to people who are from an ethnic minority background, please use your culture. Don't shy away from it, or don't shun away from it. If you are bilingual, use those skills in order to advocate for your patients, because that's how we learn. We learn by hearing stories, and I definitely do as a doctor. I mean, I didn't even know that women from my community don't think hot flushes is a significant symptom, whereas we've always been taught that is a significant, because it's all about context, right? And only 10% of consultations when it comes to ethnic minority women will ever document sexual health dysfunction. So things like vaginal atrophy, painful sex, recurrent urinary tract infections, which are all symptoms of vaginal atrophy, will ever get pieced together to say, maybe the woman needs vaginal estrogen for her recurrent UTIs and not just repeated antibiotics. So learn from each other. And there are policymakers that policies need to be changing. So, for example, we cannot accept that 1 in 4 women consider leaving their workplace. So that comes from policy. So thinking about menopause and midlife years that the woman is going through in workplaces. And luckily, we've done so much work. And then because the conversation is opening up, I recently did a talk to Coca-Cola, the BBC, and getting them to know, how can you recognize signs and symptoms of the menopause and what is available on the NHS. And Carolyn Harris, who's the Labour MP, has really made it her mission, because she suffered quite badly with her menopausal symptoms, and she's now on treatment. But the menopause bill has been discussed, and the first part of the bill has passed through, which is to bring down the cost of HRT in the UK. The second part of the bill is to make sure that it's mandatory training or mandatory education from school level. So 16-year-olds are now going to be taught in their sexual education, or what we say, relationship and educational studies, part of the curriculum, because we teach boys and girls about periods. We teach boys and girls about pregnancy, how not to fall pregnant, how to use condoms, sexually health diseases, but we don't teach them about the other bit of a woman's life, with the most significant life, because women will spend longer, 4 decades, in the midlife. So we need to be teaching kids and girls especially about, actually there is this phase from the age of 40 onwards where you'll have periods, and you might have some symptoms of hot flushes, night sweats, irritability, your libido might go down, you might end up getting digestive symptoms, your change in taste, change in your taste changes, you might get tinnitus as a sign, you might get night sweats, your mood might change. And these are all symptoms of menopause, but you'll still have periods. Menopause is 1 year without a period, and postmenopause is 1 year and 1 day without a period. And when you have a hormone deficiency condition, if you don't look after yourself, so if you smoke or you drink too much, actually, we know that there are complications of having not enough estrogen. So high risk of osteoporosis, women are high risk of getting dementia in the menopausal years, high risk of heart disease, high risk of type 2 diabetes. So these are preventative things that we can start teaching girls from a young age so they're aware of it, so they know that they can discuss their options of treatment. So preventative medicine is put in place. And then the other part of the policy making, the bill that the menopause bill is putting forward, is actually getting doctors across the country, making it mandatory. Because if 1 in 4 women feel suicidal in the UK, you cannot train as a doctor, you cannot practice as a doctor if you don't do resus. Resus is life support. But Issy, you and I know, how many times will we see a person collapse on the road that we'll need to use our resus skills? But yet, we'll see more women in our surgery who will come in with menopausal symptoms, right? Because 50% of the workload in my surgery are women. And women will, all women who have a womb, those who don't have a womb, trans men as well, will go through the changes of the transition in their midlife years. So surely we should be teaching them about menopause as mandatory as we do with resus training, because we could save lives at this rate. So back in October this year, I presented a lot of my work around with ethnic minority women at the Select Committee at the Houses of Parliament. And I feel that now, for the first time, the government is really taking a note, and changes and policies will hopefully be the better. So women can get support at work, so they're not leaving work, because we can't have that gender pay gap, and the glass ceiling has to be broken. And hopefully now we're having an ethnic minority voice as part of the conversation. You know, it's not, this is the white woman's experience and that's what's pushed through policy. And then the Asian women are just left, and we just consider them as all one entity. Whereas not, you'll know, being a black woman, that there are nuances within your community that are different to my community. You can't clump. So I hate the term BAME. I detest it.
BAME.
I'm glad you said that, because I detest that. Because as a woman of color and as a Muslim woman, my nuances are different to, you know, a Nigerian woman or a woman from Ghana or a Somalian woman. So I think that we need to get rid of this, you know, white and then other. It should all, women are women regardless of where they're from in the world. They will still have menopausal symptoms, and we need to be able to just educating healthcare professionals in regards to seeing these are all women and the color is irrelevant. They're, you know, but we need to take their cultural heritage into account in regards to how we're able to tackle their health beliefs. And then advocacy like yourself, you know, talking to women in our community. So talk to your mom, ask her about the word for menopause, ask her about vaginal dryness, and having these conversations and talking about HRT at home.
Wow. Thank you for that powerful final call to action at all levels, the policy level, the practitioners, and also the lay public. And I really appreciate what you said about, as lay people, the power that lay people, and I count myself as a lay person because we all have stories, right? And our stories can change the narrative and can change research agendas and policy focus. So thank you so much for ending on that wonderful call to action and for spending these minutes with me. I am so grateful. I'm still starstruck, and I am just keep going with all the great work you are doing. You continue to inspire many of us behind you. So thank you so much for speaking to me today.
Well, thank you so much for having me. And I would say to anybody listening, there are 3 things that I always say, take away with you. One is that use your role, whatever role it is, to share any information that you have. So if you're a woman of color going through the menopausal change, use your voice, because we as healthcare professionals listen. And to healthcare professionals, that's all you need to do, listen. Actually, that's far more powerful than doing anything else. And then, because a lot of the time people share something with me and I just store it in the back of my mind, and it's maybe even years later that I think, oh gosh, that woman said this thing, and I now know I can join up the dots. And lastly, to policymakers, listen to the professionals in their field so that we're able to do better care and take away the shame and the stigma when it comes to women's health.
Thank you very much for speaking to all of us today.
Thank you.